Begin inspection of the patient's skin by observing the patient's face. Assess the facial expression, skin moisture, or dryness, any facial swelling or asymmetry, and check for any cyanosis in the lips. Inspect and palpate the patient's fingernails, looking especially for any clubbing or cyanosis. Continue assessment of the skin by examining other body regions and note color, pigmentation, texture, hair distribution, and thickness, any lesions, and look for nevi, scars, and any distinguishing characteristics, noting their placements and dimensions.
During physical examination of the face, findings associated to an acute asthma exacerbation include signs of sinusitis, such as sinus tenderness, facial pain, or discomfort. During physical examination of the skin, findings associated to an acute asthma exacerbation include atopic dermatitis.
When examining the eyes, check for color of the conjunctiva and sclera. Inspect the cornea, iris, and lens. Compare the pupils and test their reactions to light and accommodation. With an ophthalmoscope, inspect the ocular fundi.
During physical examination of the eyes, findings associated to an acute asthma exacerbation include signs of conjunctivitis, such as redness of the conjunctiva.
Examine the ear and drum with an otoscope using the largest speculum and holding the otoscope at an upward angle. Inspect the nose for skin changes, nodules, and deformities. Conduct the nose cavity exam with an otoscope. Tilt the patient's head back slightly and holding the otoscope perpendicular and away from the patient's chin, gently place the speculum in the nasal vestibule, avoiding contact with the septum. When looking through the otoscope, gradually move the speculum posteriorly and angle it upward to glimpse the lower and middle turbinates, the nasal septum, and the narrow intervening passage. Note the color of the mucosa and the presence of any swelling, polyps, ulcerations, bleeding, discharge, blockages, deviations, or perforations.
During physical examination of the nose, findings associated to an acute asthma exacerbation include signs of rhinitis, such as nasal discharge and inflamed nasal mucosa.
Observe the lips for color, moisture, ulcers, or cracking. Ask the patient to protrude the tongue and move it from side to side, assessing for symmetry, and inspect the color and texture of its dorsal surface. Have the patient touch the tongue to the hard palate and carefully inspect its undersurface on the floor of the mouth. With a fresh tongue depressor and bright light in hand, ask the patient to open the mouth wide. Carefully inspect the buccal mucosa for ulcers, nodules, or white patches. Then, inspect the pharynx. Have the patient open wide and say ah or yawn. If the pharynx cannot be seen clearly, have the patient repeat this maneuver while you firmly press down on the tongue with a tongue depressor. Watch the soft palate rise and inspect the uvula, anterior and posterior pillars, tonsils, if present, and pharynx. Check for symmetry, discoloration, ulceration, swelling, masses, or tonsillar exudate.
During physical examination of the mouth, findings associated to an acute asthma exacerbation include halitosis and mouth breathing.
Continue with inspection, palpation, and percussion of the lungs at the posterior thorax. Percuss the lungs in a ladder pattern, going from side to side as you move down from the apices to the bases of the lungs. Normal lungs are resonant. Using the diaphragm of the stethoscope, observe rate, rhythm, depth, and effort of breathing and listen for adventitious sounds that may indicate abnormal respiratory conditions. Listen to at least one entire breathing cycle at each location. To examine the anterior thorax, have the patient remain supine and breathing normally. Inspect the chest for deformities, asymmetry, and respiratory movement. Next, palpate the chest wall to locate any areas of tenderness or to assess any lesions or abnormalities. Percuss the thorax in symmetrical areas, proceeding from the supraclavicular areas down to the sixth rib or below, comparing both sides. Then, auscultate the lungs using the diaphragm of the stethoscope. Breath sounds should be heard over the anterior lung fields.
During physical examination of the thorax, findings associated to an acute asthma exacerbation include tachypnea, hypoxia, accessory muscle use, decreased air entry or wheezing on auscultation, a prolonged expiratory phase on auscultation, and an increased anterior-posterior diameter of the chest.